guys, let's dive into the osteology of the clavicle and see what we can be able to see here. So before then, we should know that clavicle is the longest horizontal bone in the body, and it's also a superficial bone that we can be able to see within the distal part of our neck. And this bone, clavicle here, has an S-shaped structure, and it's also kind of subcutaneous kind of bone that we can be able to see all through the length of this clavicle. And most importantly, clavicle is the first bone to ossify in the body within 5 to 6 weeks of fetal life. So what's the function of this clavicle here? This clavicle helps to what? It connects the upper limb to the trunk, and it also helps to transmit forces from the upper limb to the axial skeleton. And again, this clavicle here, it helps to protect underlying structures like the brachial plexus, the subclavian arteries, and some vessels as well. So let's look at the parts of this clavicle. So this clavicle here has mainly two parts. One, we have this side here. So this side is called the lateral part. So this is called the lateral 1/3 of the clavicle. Okay, why this area here is called the medial 1/3, medial 2/3 of the clavicle, and in between this medial and the lateral end here, this area is called the shaft of the clavicle. So this lateral 1/3 of the clavicle here continues here and becomes what we call the acromial end of the clavicle. Okay, so this acromial end of the clavicle here has a little kind of oval facet that articulates with the acromial process. Okay, so this is the acromial end here, articulating with the acromial process of the scapula, forming a kind of joint here. So this joint here is called the acromioclavicular joint. Okay, so when we look at this acromial end, so when we turn it posterior, let's look at the structures we can see within the posterior aspect of the acromial end. So we have this bump here, this protrusion here. So this is called the conoid tubercle. So this conoid tubercle here serves as attachment of ligaments like the conoid ligament, and it also serves as another attachment for medial part of the coracoclavicular ligament. And then when we move a bit forward, we see another kind of imaginary kind of ligament. This is a model. So this line here is called the trapezoid line. So this trapezoid line serves as attachment to trapezoid ligament and the lateral part of coracoclavicular ligament. Okay? So let's look at the medial 2/3 of this clavicle. So this medial 2/3 here is kind of cylindrical in shape, and it continues to become the sternal end of the clavicle. So we can see a facet here. So this medial end of the clavicle, the sternal end, we articulate with the manibrum sterni of the clavicle here to form what we call the sternoclavicular joint. Okay, so the sternal end of the clavicle, we articulate with the manibrum sterni of the sternum to form the sternoclavicular joint. Okay, so when we look at the shaft in between, so this area is called the shaft of the clavicle, and then when we turn the inferior aspect of this shaft, we see what we call the subclavian groove. So this subclavian groove contains a muscle called the subclavius muscle, which helps to depress the clavicle. So this subclavian groove here is very close proximity with the brachial plexus and then the subclavian vein. This area here is called the subclavian vein, and there is an artery that runs up from it. That artery is called the subclavian artery that we can easily palpate. You can see the pulsation of this subclavian artery on the anterior posterior triangle of the neck. Okay, so let's look at the muscles that attach on this clavicle here. There are about 6 muscles that attach on the clavicle, and 4 of these muscles are attached at the sternal end, while 2 of these muscles are attached at the acromial end. Okay, so one of these muscles are the sternocleidomastoid muscle. These are the pectoralis major muscle. These are the subclavius muscle, stenohyoid muscle, trapezoid muscle, and deltoid muscle. Okay, so the sternocleidomastoid muscle attached on the superior surface and attached on the superior surface of this bone, mainly at the sternal end. So this is the area where we can see the attachment of the sternocleidomastoid muscle. Okay, so we have another muscle here. We call it the pectoralis major muscle. So this muscle attached on the anterior surface of this bone, mainly at the sternal end. So anterior surface here is where we see the attachment of the pectoralis major. So another muscle again is the subclavius muscles that we say we can see within the subclavian groove that helps to depress the clavicle. So it is found within the subclavian groove, okay, inferior aspect of the subclavian groove. So we have the next muscle, which is the stenohyoid muscle that attach on the sternal end as well, as sternal end of the clavicle. Okay, so we have the next muscle that attach on the clavicle, which is the trapezius muscle. So this muscle attach along the posterior surface. So this muscle attach along the posterior surface of the clavicle. Okay, mainly at the acromial end of the clavicle. Then we have the last muscle, which is called the deltoid muscle. Okay, so this deltoid muscle here is found with the attached at the anterior surface of this clavicle, mainly at the acromial end. Okay, so within this subclavian groove as well is within this area here, this sternoclavicular joint, the posterior relation of this sternoclavicular joint is that is where we have the bifurcation of brachiocephalic trunk that forms the subclavian arteries and common carotid artery. So they are mainly found within the posterior surface of this sternoclavicular joints here. Okay, and this clavicle has so many clinical relevance, and this fracture of this clavicle is most clinically presented in clinical settings. So most commonly we have fractures within this clavicle here. So these fractures, 15% of this fracture occurs at the lateral end of the clavicle, 80% of the fracture occurs within the middle shaft, this area of the clavicle, and about 5% occurs at the sternal end of the clavicle. So thank you, and see us continue with the osteology of the humerus. Thanks.